My name is Dr. James Kelly. I'm an ophthalmologist and I've been performing surgery for about 23 years now. Part of what makes my patients feel comfortable is the fact that I've been doing this for over 20 years and that my practice is almost exclusively dedicated to this field. It allows me to use the latest technology available. I also tell them that over 20 years ago I had the procedure performed in my own eyes, and I think that makes them feel comfortable knowing that the doctor who once wore glasses and contact lenses had the procedure done, and this was 20 years ago when the technology was good, but not as good as it is today. So typically what happens, a person hears about the surgery through a friend or a family member or maybe even a coworker, and then they will make a phone call and schedule an appointment to come in. At that point, we do a full medical evaluation. We find out about their history of contact lenses and glasses, and then they're put through a fairly extensive eye examination that includes several measurements of the front and back of their eye.
I found Dr. Kelly just on the internet. I had to come in for just kind of an eye checkup. I didn't have any consistent eye doctor. Came in, the staff were all super professional, and then he was great. And I had never really thought about it before. I was always just using contacts and I hated them, but I always assumed kind of Lasik was something I would never really get. We did the tests, everything worked out, and I decided to go through with it, and it's been great.
On the day when I have a consultation with Dr. Kelly, I just believe that this is the time and that's the guy that can make my vision better. But I just feel I have a faith with Dr. Kelly, and then like we all know that he done that so many times, maybe thousands of times. So I believe that he can make my daily activity better, life-changing for me too. Yeah.
After they're fully deemed a candidate, they'll meet with one of our surgical coordinators, and they will go through a process where they go over the different available dates and the drops they have to use, and they'll go through any financing that may be necessary, and then they actually will schedule a specific date. When they come in that date, they usually arrive at the office about 15 minutes before their appointed time, and they're given some numbing drops to use, and we make sure all of the forms are filled out that need to be filled out. I meet with them and I answer any final questions they may have, and then we bring them in the laser room. Typically the surgery takes about 10 minutes, and it usually is about 5 minutes for each eye. In order to make the patient as comfortable as possible, we have a technician hold their hand during the procedure, and interestingly enough, when we see patients years later for follow-up examinations, they don't remember me, they remember the person who held their hand, so I've found that very interesting. But while they're in the laser room, I explain to them what's going on during the surgery, and as I said, it typically takes about 5 minutes, and the only discomfort they have is the eyelid retractor that we put in that prevents them from blinking, but other than that, it's a fairly comfortable procedure.
The actual surgery was easy. It was much simpler than I thought it would be. I was in there for 15-20 minutes, no pain whatsoever. He was there the whole time, coaching me through it before I knew it was over, and I was on my way, and I was healed up within a few hours.
Well, it's interesting. Right after the procedure, we have a clock on the wall right next to the laser, and we'll sit them up. And one of the first things they do is they can't even help it. They look at the clock and they think, oh my gosh, I couldn't have seen that just 10 minutes before. I tell them I'll see them the next day, and they come in and their vision is even far better than it was when I left them right after the laser procedure. And so they're excited to ask me questions, and they want to know, well, what can they do, what their limitations are, and I tell them they could pretty much resume most of their normal activities. And they'll say, I can drive now without glasses, without contacts, and I'll say, yeah, we took your vision and you've passed all the tests. We give them an instruction list with all of the do's and don'ts, but they're often able to resume most of those physical activities and get back to work within a few days.
Right when I got out of the room, I noticed it was even slightly better, and that's pretty crazy considering I was just underneath the machine a few minutes ago. They told me to get home and get some sleep, get some rest, and then that's what I did. I woke up and my vision was already perfect. It was better than it was when I was wearing contacts every day, which is pretty mind-blowing considering 12 hours before that, I needed glasses to get around, I needed contacts to get around. So
because I have my Lasik right now, so I have more time with my family. I don't have to put back on or take it off for the contact lenses. Because every time I woke up, I have to look at the clock and oh, okay, what time is it? I have to grab something to put it on. Oh, okay. But now I just like open my eyes and just, okay, I can see really clear.
I would definitely recommend LASIK to anybody thinking about it. I mean, just come in, speak with Dr. Kelly, and I think it'll be worth the time.
I definitely will recommend a Lasik to all my family members or friends. Don't doubt about it, just go with that. And then, of course, you have to find someone that you trust. And I'm absolutely recommend Dr. Kelly to go to be our Lasik surgeon.
For someone to, explore this opportunity, find out if they're a candidate, come into the office. The consultation is free. The process is fairly easy to undergo, and they can go on to a lifetime of great vision and have that independence and freedom of not being dependent on glasses and contacts. And the first step is picking up the phone.